Yeah, good morning, colleagues. Sorry about the delay. Now we are ready to proceed. Today, as earlier indicated, we will have a session covering the maternity and delivery workflow using the PHC package. And then we'll also hear on how to set up the biometric scanners, the common ways for you to troubleshoot at the facility. This has been reported on previously. Before we get into it, allow me to just again remind us again of what we need to have in place for the PHC integrated TaifaCareK to work for you at the facility. Again, we want to emphasize the first thing is you need to have equipment, the tablets, and the servers that are already set up for you. Number two, which is very important now because it's a primary way of identifying the clients, is again the biometric scanners. So those scanners need to be working. They need to be well connected to TaifaCareK. Again, as I explained, we are going to cover a bit of this today. In case the biometric scanners fail totally, there is a small window to get allowances for you to use OTP whitelisting, but that will be on incidental basis. For this all to work together for you, you must have the new package of Kenya EMR version set up for you. As we've explained previously, the version will be upgraded for you by the technical team, so you don't have to worry about that. But what you need to do at the facility level is to update your chargeable services. That's the clinical, the clinical services, all of those that are billable, the commodities and the non-farms at the facility. You have to indicate the item, the prices, in the same way that you've been going through setting up stock and setting up the clinical services. Next, you'll have to tightly now integrate the PHC workflow. That means now we need to integrate the data clerks, the SHA data clerks with our record teams so that we are able to check in clients when they start the PHC visits, and we are also able to check them out. That is the only way in which your submissions are going to be valid. The next is all our clinical staff and providers need to be authenticated against their respective registration bodies. Again, this is something we've shown you several times. By entering your ID number on the user page, you are able to synchronize with the registration body so that it shows you whether you have active registration or not. And last but not least, we expect you to continue orientating yourself with the SOPs and the videos that are available online on how to use the eClaims procedure and modules from the TaifaCareK. But we will be sharing the SOPs once this series of trainings are over. So that is it for now. We expect a fairly good training. I'm joined by my colleagues, Marianne and Evelyn, and also someone from Safaricom to take us through the biometric scanning training, troubleshooting, and how to do the common setup. So I would like to hand it over at this point to Marianne so that we can continue with the sessions. Marianne, if you're on the call, take it over.
Thank you, John. Confirm you can hear me.
Yeah, you're loud and clear.
All right, so allow me to set up my screen so that we can go through together the session for today. The session that we're covering today, we are looking at a scenario of a mother who is coming to the facility to deliver so that we can see how that workflow is for claims management. Remember, we said the reason why we're integrating claims management with HMIS or EMR systems is so that we can be able to eliminate fraudulent claims activities. And the proposed solution is integrating a stepwise verification process using biometrics and OTP verification every step of the way until the claim is approved by the payer. So when we've been doing these trainings, we said there are several things that need to be done even before the facility team can be able to use this feature. One of those things is we need to add billable charges to all the services and commodities that will be used by our patients or our clients so that we can be able to charge them for those services. So just a quick recap of this. This will be available and it will be done by either the admin staffs, the system administrators, the finance managers, or billing officers who have an expanded role. From the billing module, they will be able to add clinical charges. And what this means is just attaching a price to a particular service or a particular commodity, either as a charge item or as a charge service. And we can be able to define the price for each particular mode of payment that this particular facility will use to charge clients for. The amount sent for insurance, the amount sent for my mobile money, cash, just as an example. The other thing we said is that when we are setting up the different payment modes, when our users coming to the facility, how they will be making payments. Will they be using cash? Do we accept monetary services in terms of cash, insurance methods, or mobile money, the likes of M-Pesa? There's a particular package that comes with the installation that has preloaded these three for cash, insurance, and mobile money. And we agreed we do not alter what comes with the package, but there's an option of adding another payment method if it is not among these ones that a facility uses. For example, a facility may also be processing payments through checks, so we can decide to add a payment method called checks, and it will be one of the ways we'll be using to process payments for our clients. But for the three that comes with the package, kindly do not alter, do not edit, do not delete, because they have specific IDs attached to them. For example, if you deleted the mobile money one, and it comes to a point in our facility where we want to integrate maybe M-Pesa STK push, we're going to have a problem with the package. Same case with insurance. If we rename this to something else, then the insurance workflow within the system will not flow the way it has been set. So let's be vigilant of that. Make sure that we have the correct payment modes within the facility, and we have included all our billable charges. The next administrative task will be something that will be done either by the system administrators in the facility, the ICT teams, and the EMR champions to ensure that they have set up all the user credentials correctly, assigning credentials as per the user roles and responsibilities within the system. So how they will do this is to ensure that from the administrator, there's a feature for managing users. We'll be able to add a user, attach them to specific roles. Now, the guidance here is that for all our healthcare workers, when we are adding them as users and giving them roles, we need to ensure that those ones that we can verify from the healthcare worker registry, we're able to do that either using a specific identifier, a national ID, registration number, and the likes, a national ID, then choose the specific regulator so that we can be able to pull their license numbers and to see whether they have a valid license or not. And we can be able to do this from the Kenya Medical Practitioners and Dentist Council, the Nursing Council for Nurses, Pharmacy and Poisons Board for our pharmaceutical technologists, Clinical Officers Council for our CEOs, and our MOs using the Kenya Medical Practitioners and Dentist Council boards. So why we need this done is because we need to ensure that all our users in the system who will be managing and seeing the patients and who will eventually attach to the claim form have a valid license. And we can be able to see when they log in their particular homepage, the system will be able to show you who they are, their license number and when it is expiring, as well as whether the status of the license, whether it is valid or not. So for a user who has logged in and they do not have a valid license, here the system does not show they have a valid license, then we will not be able to attach to the claim form, and that claim form will not be accepted. So that is one of the things we need to ensure. For the clinicians whom we are using to attach their details to the claim form, they should have a valid license. The third thing we need to ensure is that all our stocks are in, we are using the stock management module. Reason because commodities that are out of stock will not create a billable line for you. And remember, we need anything that we're charging for the patient to be attached as billable line for us to claim for that particular service. So a small recap again on the technical issues: adding billable charges, ensuring we have the correct payment modes, validating our MOs, medical officers and clinical officers from the healthcare worker registries, then adding all stock items that are applicable and all will be given to a patient so that they can create billable line items. So now allow me to start us off with the workflow of a patient who is coming to the facility, presenting with the labor pains, so that you can see the workflow for that and eventually how we are going to process that particular claim form for that patient. So I'm going to use a user who has authorized us to use their credentials, and I'm going to follow the workflow of a patient all the way from when the patient comes to the facility, how we onboard them in our system through the registration desk. So within the system is also emulating the workflow of a patient. I'm going to start from registration. At registration, the way we onboard a client within TaifaCareK EMR, one is by searching from the HIE layer, where we can use a specific identifier type. An identifier type can either be one of these, and we categorize them in terms of identifiers that can be used for an adult. For example, for a person who is above 18 years, we can use the national ID. We can use a passport number to get the national ID, because we usually use the national ID. For children or people who are below 18 years, we can either use a birth certificate number or a notification number. For people who come to our facilities who are non-citizens, we can either use an alien number or we can use a refugee number. Also, we have cases where we have underage pregnant mothers, where we can also use the mandate number for that. So for my case scenario, I'm going to use a national ID. Then we are going to search for our patient. And this is the recommended workflow. But in cases where we may not be able to have an identification from a client who is coming to our facility, either they came in a state where we can't be able to verify them, or they really do not have any identifier, the system allows you to be able to create an emergency registration by now adding that patient manually in the system. So when I use my national ID identifier and search for the patient, this particular instance, your machine should be on internet. So because we are searching from the HIE servers, and it will pull for me details, probable details of the patient who was registered using this particular ID. It will show you the name masked or hashed, show you the age of the patient, their date of birth, and also give you their CR number. So at this point, we said we need the patient to authorize us to be able to access and use the information by sending them an OTP. So we're going to do that. One, verify the phone number that the client registered with for SHA, or that is in their Afya Yangu app. Send the OTP to them. That is where the OTP will be sent, and ask the client to check their phone for that OTP. So the client will receive an OTP saying, "Hello, Miriam. Icon Health Center Limited wants to access your clinical records for claims processing. Use this particular code." So this is the code we are going to use as our authorization code from the client to access their details. And when we do that, we verify. So once you verify the OTP, now the system will allow you, one, to confirm who is coming for clinical service. Is it the primary member or is it the dependent? If it is the dependent, either a child or a spouse, then you'll be able to show the dependent, go through and check the person who is coming for services. But for my instance, I'm going to check in the primary person as the person who is coming seeking services within the MCH for delivery. So here, the system will allow you to start the visit by clicking on checking in, and it will load for you the start visit form. So from the start visit form, the first thing the system will do, it will show you that you're trying to start a new visit for a patient who is coming in as a new client. For other clients, maybe they had come to the facility during the day, you can either choose to use a particular visit that is in the past or a visit that is ongoing. But for this scenario, when the patient comes in after every 24 hours, it will create for you to start a new visit. Then the visit location, confirm that we are within the facility itself. Then we will select the visit type. We expect our patient to have these particular services from inpatient or receive them from inpatient. Then we are going to follow the patient cascade. So when they come, because they're coming for clinical services, we will want them to start with the first clinical service, which is maybe triad, and we will send them to the appropriate triad room. So for my client, I'm going to send her to MCH triad room 1. Then we're going to determine how the patient is going to be paying for the services and commodities they will receive in this facility by asking if whether the patient is exempted from payment. For my case, if the patient is exempted, we will say yes, and then we will select the correct or applicable exemption category. And again, this is configurable per facility. But if this is not the case, we expect our patient to pay, we will say no. Then we request them how they will be making payments. They will say they have insurance, so we will select insurance. Then we need to determine if they're paying via insurance, which particular insurance scheme are they going to use? So for my case, I'm going to select SHA. Then when you do that, you will notice that the system will populate for you the policy number. It will also be able to show you the active schemes that my patient is on. They are active for PHC and SHIF, and the status is active. Now, remember we had said before, if you find that your patient maybe had been registered to SHA, but their scheme is not active, then at this point you may want to advise your patient that you cannot proceed with the claim to claim services from SHA. They may want to pay cash. So let me try an example of a patient who has not been registered to SHA to show you how the system is going to guide you on that workflow. So allow me to just search from a patient within my DB. Just going to use a test patient for this. So I'm going to assume this particular patient, showing very well they are not registered to SHA. But in case the person who is checking them in at the registration desk tries to select insurance for service as a payment method, again, the system will ask you which insurance scheme the client is paying. Maybe they have a private insurance, but if they tell you SHA, and remember they've not registered to SHA, the system is going to give you one, it is going to tell you the patient is missing a SHA identification number, and the patient SHA validation cannot be done for one from the HIE layer, and they may need to visit the registration desk for them to update their registration details for SHA. Two, it will also notify you the patient has no SHA CR number, proceeding without a virtual claim. So a virtual claim cannot be created for this particular patient, and you may need now to advise them they need to pay via other methods, either via another insurance or they pay via cash or mobile money. So let's go back to our patient. Proceed with our workflow. What happened to my patient? Let me just search for them quickly. So we had not checked them in, so I'll still just load the check-in form, proceed up to where we were. They're coming for inpatient services. We had queued them to MCH room 1. They're using insurance, SHA, to pay. Scheme was SHA. We can see their active schemes, then we can proceed. So we remember for PHC, it will not allow you to have any elective visit. But because my patient is also eligible for SHIF, if they had previously had maybe a planned CS or which is an elective visit, if we say yes, the system will expect you to give the authorization code for that pre-auth that had been previously done and approved. But for my case, I'm not going to follow that workflow. I will assume my patient is just coming, presenting with labor pains, and then we will decide. The clinician is the one to decide whether they are going to have a CS or a normal delivery. Then the SHIF package that we should choose. Again, this is dependent on the service that the person is seeking and also the scheme that they are active on. So for my case, because we are seeking for maternity services, I am going to select SHIF 8, which provides for maternity, neonatal, child health services. Then within the system, the intervention that the patient is seeking for is validated against the SHIF package. So we will select the packages, which are only 2 for this particular package. Only 2 interventions are allowed. That is cesarean section, where no pre-authorization is required, and a vaginal delivery where no pre-authorization is required. So as we continue to select the SHIF packages and interact with the different packages, we will be able to see how the system guides on which ones require pre-authorizations and which ones do not. For example, if you were to choose SHIF 9 for medical imaging, the interventions that can be selected or given to this patient, some of them may have pre-authorizations required. Allow me just to pick one. Maybe something like let's see, critical care has. I'm going to see one that has pre-authorization. For example, like this one, if this was the package that had been chosen, and this is the particular intervention our patient is seeking, you will be able to be guided at the patient by the system that this particular intervention will require a pre-authorization. So let us go back to our SHIF package, which was SHIF 8 for the services my client is seeking for. And at this point, you can choose either a cesarean section or a vaginal delivery. For this particular training, allow me to choose cesarean section. And the system will show you no pre-authorization is needed for that. Then now, for this particular service, I'm using the workflow. Remember, we had queued our patient to triage in room 1 at MCH. For them to receive that particular service within the facility, do we expect them to pay for something like consultation, maybe at the point where they are being reviewed at the MCH, so we can be able to select the charge service. So the charge services we select here is what I had said. We need to ensure that we have attached prices. We have created charge items within the system already and attached prices to them, so that the moment we select the first chargeable service, it will create a bill item that is chargeable, and it will also be attached to the claim form. Then when we are done, just confirm again you fill the correct thing. We have the correct visit where our patient is coming to within the facility, where they will receive clinical services. We have selected the correct visit type. We have initiated the patient cascade AMA expected workflow. We have established how our patient is going to pay. We have selected the correct package and the correct intervention that our patient requires. Then we can go ahead to verify and start a visit. So when we do that, the step that has been added here is that the system will expect for you to authenticate this particular patient. And this can be done in 2 ways. The recommended way is to use biometrics, whereby we're going to use a scanner for us to be able to search the fingerprint of our patient through the government records using eCitizen to verify whether this is a person who is claiming to have that ID number, who is claiming to have that active SHIF package within the system. This is the recommended way, and all facilities would be required to use this. But in cases where we will not be able to use biometrics because of one reason or another, then we can be able to request for whitelisting so that we can proceed to authenticate our patient. So at this point, we may not have a lot of patients who will not be using biometrics, but in case we are not able, one, to validate the biometrics, we've tried several times with the scanner and we cannot be able to, we can select whitelisting, and we need to give a reason why. Some of the reasons you'll find are, one, you have tried severally to authenticate the patient through the biometric process, but it has failed. 2, maybe something like the patient is elderly, above 60 years. The patient is also maybe a child below 7 years, and the likes. Maybe they have a disability, something happened to their fingers. We can't be able to really scan the fingerprint. So for my case, because I may not be able to use the biometric right now, but it's something that will be shown later on in this particular session in a training, I'm going to request for whitelisting. My number had already been whitelisted. So the moment you do that, again, another verification OTP will be required to be sent to your client. So I'm going to request for the OTP. You will notice for this particular OTP, we expect it to have 6 digits as opposed to the OTP shared by the facility that has 5 digits. So this one, I'm just going to read it. Dear Marianne, please confirm the information provided is accurate and consent to the cesarean section services for yourself. This particular facility. Kindly note that making false statements under the Social Health Insurance Act of 2023 is an offense, and you will proceed to get that OTP from the client. So I'm going to input it, 643813, and verify my client. When you do that and the verification is successful, the system is going to give you a feedback. It's going to give you messages for a particular successful message. 1, the visit has been started successfully. The patient bill has been created because we had selected adult consultation. So whatever price is attached to adult consultation, that bill has been created in the system. 3, our patient has been queued to the first service area, which is in triage MCH. And 4, the system has created a virtual claim form for our patient, so that now whatever services we are going to offer them, we're going to have a stepwise interactions for the claim form. So for this particular junction, I'm going to hand it over to my colleague, who will now quickly take us through the workflow for the patient at the maternity, all the way from reviewing them within the MCH triage quickly, the MCH consultation to determine that they may need an admission, admit them, offer them services in inpatient, and eventually discharge them so that you can come back to the billing area at the final stage when our patient is being discharged to go through the claims workflow. So Evelyn, if you're on the call, you can unmute on your end and proceed. Allow me to unshare my screen. Evelyn? The host of the meeting kindly unmute Evelyn. She's unable to unmute on end.
I think she has a mic now.
She's okay now. Evelyn, you can proceed.
Yeah.
So good morning, everyone. I'm going to take you through the clinical journey for the patient, that is from the MCH up to the labor and then to discharge. So allow me please to share my screen. Please confirm if you can be able to see my screen.
Yeah,
Yes,
we
yes.
Okay, so first things first, I've I've logged in as an admin so that I can be able to do several things. So as the personnel sitting in MCH, I will come to the MCH. This is the thing, this is what you will see, the module that you will see while seated in MCH. So I will come to the MCH and I will locate my location. Just a minute, let me check if the okay, it means like the patient didn't reach MCH. So just allow me to search the patient. So this is the patient, Marianne. You can be able to see the summary. She has the vitals and anthropometrics. So let's assume this mother is in MCH. Then we will go to NC for us to be able to see this mother. Let's assume the mother has come for the NC visits and she didn't know maybe she's in labor or she's going to deliver. So we will do the NC as normal. So we'll come here to the NC and then we click on the options. Then we can be able to locate our MCH antenatal visit. So then we take the NC number. Just allow me to do some modification. NC contacts, maybe this is the 5th. She's maybe para 1.
Evelyn, I don't know whether it's only the end. You can reshare your screen
yes,
again. You seem to be in a step ahead that I cannot be able to see.
Okay, let me just stop sharing and then Can you be able to see? Marianne?
Not yet, but it's coming up.
It's coming up.
Ajang, you can confirm your end as well. It may be my network.
So I think she's on proxy. So if she can turn proxy off and then she just shares.
Okay, so let's say the LMP was 2015. That is November. This is 2 minutes. Let me get another one. It's October. That's 29th. Then the maturity, let's say it's 37 weeks. Then we do the patient history, any past medical history. They say there's none. Any past
Evelyn,
surgical history? No.
E-
Yes,
E-
please.
Evelyn, we are still not seeing.
See my
Someone.
screen.
No, it's not showing at all.
It's not showing at all. Let me then leave and then rejoin. I don't know, maybe if it's from my end, maybe the network, I don't know. Can I just leave and then rejoin? Kindly.
Yeah, please do that.
Okay. Please confirm if you can see it, if the screen is up.
Yes.
Yeah, we are seeing your emails. So
My emails.
yeah,
Okay,
move to the next window. Just move to the next window.
it's okay. Yes, John, confirm, please.
Evelyn, allow me to share my screen so that I can just navigate for you as you talk through the session. That will be fine.
Oh, that will be fine. That's okay.
All right. So let me share my screen now. So our client is at a MCH triage room 1. They have a vitals of yesterday, which can still be used. Then you can proceed from there, Evelyn.
So then navigate to the care panel. Let's go to the program enrollment. Program enrollment. Then on the antenatal care. Then open the MCH antenatal visit. So then let's quickly fill in this. That's the patient visit. Let's give it any number, 2020, okay. NC, let's say this is maybe the 5th contact, the parity 1 plus 0. The gravida is autopopulated, LMP. Let's put it 2025, October. Then maturity, let's say maturity is 38. Then we go to patient history. So on patient history, we have the any past medical history, let's say it's none. Then any past surgical history, this is also being looked into. It's for the female. Then family history of twins, no. Then family history of tuberculosis, no. The previous pregnancies, that is obstetric history, let's say add, so that we can be able to do the obstetric history. That is the pregnancy order, because the mother was a para 1 plus 0. So this is the first one. The year of previous pregnancy, let's say it's 2013, 2023 maybe. The number of antenatal visits, let's maybe 4. Place of childbirth, it was health facility. She gave birth at the gestation of 39. Duration of labor, that it took around 10 hours. It was a spontaneous vaginal delivery. Then the birth weight, it was around 3,000 grams. The baby is a female. The outcome was a live birth. Puparium, no, there were no complications. So if there were multiple pregnancies, you can be able to add other babies. But for this case, it is a para 1, so it's just 1. Then we go to patient examination. So we have physical examination. Everything looks normal. Then systolic, it has auto-populated. Then the abdominal findings. Breast findings, let's say everything is normal for us to go very fast. Let's say the fundus is 38, 40. No parlor. Fundal height is 38. It's cephalic. Presentation is cephalic. Presentation. The lie is longitudinal. Fetal heart rate regular. Let's say this is 140 beats per minute. The fetal movement present. The mental screening is done. Let's continue. Let's continue, Marianne. The antenatal profile done elsewhere, no, so that we can be able to move very fast. Then we have, if you say no, you can be able to add a lab order. But at this time, let's bypass that one. So if you say yes, you can be able, Marianne, just say yes, so that we can be able to show what you are supposed to key in. So you can be able to key in if you have the results for the NC profile. Then we do the TB screening, patient on anti-TB drugs. Let's say no. Then we do the ICF. It gives you the results TB status, that is no TB signs. Then let's continue. We go to ultrasound. The ultrasound, no ultrasound done at this particular moment. If you want to do an ultrasound, you can add imaging from here. Then we go the triple testing. Let's do initial. Then consent been given, yes. It's an individual. Let's pick kit 1. Lot number. Expiry date. The final results. Then hepatitis B screening, it's non-reactive, no partner. Then let's go to patient management. Any preventive services that has been given, let's bypass that one. But you can be able to add so that they can see what is in there. Marianne, please add. So we have the services, the date given, and the next visit for that survey, for that preventive services. So we can be able to go to the infant feeding. You can pick any. Appointment given, an appointment given there. Let's go to, we do the saving of the form. So we can go to the inpatient. We go record admission. Let's say we are admitting to antenatal ward. Okay. Then we go to admission. So in admission, let's go to the action. Admit patient. So the major complaint here, it's the lower abdominal pains. Radiating to the back. Drainage of liquor, okay. Okay, we can write there. Let's say spontaneous vertex delivery. Spontaneous vertex delivery, yeah. Then the payment method. Then we give a bed. We allocate a bed for this mother. Then we admit. So the mother moves to admission. Then now here we can be able to open the profile for this mother. So upon opening the profile for the mother, you go direct to the inpatient. So in the inpatient, you can be able to see we have the tabs here. We have the labor care guide, the admission request, the inpatient details, the pathograph. So we have the labor care guide and the pathograph. The labor care guide will replace the pathograph. Then we have the treatment sheet. So for this case, for this mother, let's assume this mother is now maybe something like we have admitted this mother to the labor care guide. So before we do anything else, we need to do the examination for this mother and take some history in the ward, in the labor ward. So for that one, we use the maternity inpatient form. So in here, we have details we need to fill in, the name of the clinic attended. We need again to fill in the parity. That's 1, 0. LMP. Okay, then we go to the medical history. Any blood transfusion, no. Family history, there's nothing there. Obstetric history, we add. That's the first pregnancy, 2023. Number of antenatal visits, let's say it's 4. It was health facility. It was 39. Duration 10. Spontaneous. Birth weight was 3,000 grams. It's a female. The outcome alive. Exclusive breastfeeding by that moment. Puerperium, there was no any complication. So for the NC profile, let's say no. Non-reactive, HIV non-reactive, not eligible for testing. No consent given. No partner. Okay. Then admission, we need to give consent for the admission. Then the height of the funders, that is 38. It's a cephalic. Engagement, let's say it's 5. Then the position, hospital anterior. Fetal heart rate, 140. No vaginal discharge. The external genitalia, it's normal. So we can be able to continue. We don't have to fill everything here. So then after that, it opens for us the labor care guide. So for the labor care guide, the first thing, you need to be admitted in the labor ward or maternity ward or antenatal ward. So let's start filling in the labor care guide, and this labor care guide, let's assume that this mother is 5 centimeter dilated. So let's start with adding first, filling in the labor onset that is spontaneous. Select on the labor onset. Then we have the diagnosis date, it's today. Then the risk factors, let's say maybe it's do multiple gestation. Then rupture of membrane, it's yes. The date rupture, let's say it started, it was yesterday. Let's put yesterday. Then the hours, let's say it was around 3 a.m. I ran just the time. Then we save. Then afterwards, we need to go to add. The time, you save the time. This is the time now you are starting the labor care guide. Then we have now the things that the parameters which are being monitored during labor. So we have the supportive care. So you can be able to see because we selected on the risk factors, it was a multiple gestation. So we have 2-in-1. When you go to the baby, we have 2-in-1, and you can be able to add the 2-in-2. Then we have the mothers and the labor progress. Then we have the medication and the shared decision making. So let's start filling in the labor care guide. So we start with the supportive care, where we have the companion, pain relief, oral fluids, and posture. So Marianne, you can click on add. So here we have the hours. This is the exact time that you are doing this. So we go to select the companion. No. Then pain relief. Let's say no. Then oral fluid. Let's say yes. Then the posture. Let's say it is spine. So as you can be able to see here, we also have on this color, I don't know which color is this, is it orange or something? Where we have the alerts, it tells you the normals and the abnormals. So this, when it is no, it's an alert. It's something which should be worked on. So you can be able to see here, the mother doesn't have a companion and it has circled, it's red, no pain relief. We have the oral fluids that she's been taking the fluids. So that is a good thing. The posture, it's supine, she should be mobile, and other postures. Then we go to the twin one, that is the baby, the first baby, to monitor the first baby. So Marianne, let's go to add. So let's go to the baseline, fetal heart rate. Marianne? Let's now say the baseline fetal heart rate right now, it's 170. The fetal deceleration, it's late. Then we have the amniotic fluid. Let's say it's +2. Then fetal position for this baby, late anterior. Then we have the caput, let's say it's +2. Then molding, let's say it's +1. Then we save. So then we go to the mother, to the twin 2, because it's a multiple gestation. So the fetal heart rate for this, let's say it's 160. The fetal heart rate, it's late. Then let's save. So for the twin 2, because for the something like the amniotic fluid, the amniotic fluid, the fetal position, the caput and molding, these are things that are being shared. The only thing that we do for the if it's a multiple gestation, we check the baseline and the fetal deceleration. Those are the things that they don't share. So then let's go to the mother now. So we have the pulse rate for the mother, let's say it's at 8. Systolic, let's say that is 128. Diastolic, 85. The temperature is 37.8. Protein, let's say nil. That's P minus. Okay, P minus. Then acetone, let's say it's nil also. Okay, we save. Then let's say to the contractions. Contraction, let's say the contraction per minute, that is 5 contraction per minute up here. And lasting for 30 seconds. Cervical dilatation, it's 5. Descent, it's 4. Okay. Then let's go to medication given. Let's say no. No to medication. Then IV fluids, let's say we are giving normal saline. Then we save. So I want you, Marianne, to go to the table here on the medication. On the medication, the table. The black one, yes. You can be able to see what you have given. If it's the IV fluid, what you have given, then we can continue now. Let's go to the assessment. You add. Then you can be able to see all alerts, the things that you are supposed to be able to action on. You can be able to see like the baseline, it's this and everything. So you can be able to write anything here. Let's say maybe in companion, let's say encourage the mother to come with a companion, just under assessment up here. Because if we don't do assessment up here, after some time, for example, this companion, it's supposed to be done hourly. After that time elapses and we didn't do any assessment on that, we have a bell that will start alerting you that you need to do something. So we don't want that to happen. So Marianne, just to put the companion under the companion. No, just assessment. Yes. Then here under planner, let's say now, because we are not seeing any progression of this, let's assume there is no any progression because we can't go through like we wait for 4 hours and everything 30 minutes to do others. Let's say assume this mother is going for cesarean, and because it's a match for pregnancy, let's say the plan is for cesarean section, prepare for cesarean section. Then let's go to action very quickly. Action. Okay, then save. So then afterwards, you have sent this mother to cesarean section. So after that, we go to procedure so that we can be able to order for that cesarean section for us to be able to queue this mother to the cesarean section, and the labor care guide will remain open till the mother gives birth, till the cesarean section is being done, because even in before the cesarean section is being done, they will continue to use the labor care guide to monitor the mother and the babies. Yes, Marianne? To procedure. Let's say it's a major one, it's an emergency. Then the order reason. Order reason, it's multiple pregnancy. Oh, it's okay. Multiple gestation, it's okay, pregnancy. It's okay, let's continue. Then move to procedure queue. So from there, let's go to admission for us to be able to fill in some forms for this mother to be prepared for theater.
Evelyn, because of time, we may need to just do the essential ones that will
Okay.
will need to attach the claim form. Then we can just give a guide on what they need to fill out.
Okay, then maybe you go to locate the patient. It's loading slowly from my side. I don't know that if that is also from your side. Then let's go to the inpatient. So in the inpatient, let's go to the inpatient details. So in the inpatient details, we have these particular forms here. So we have the operation checklist. That is the first thing to do first. Then we have the Then we have the IPD procedure form. That's when you are doing the procedure. Then after that, we do the post-operation form. So the post-operation form, I think that needs to be filled. Then after that, you do the delivery form. That is the delivery summary. That has been done today. Then we have the operation that is cesarean. The anesthesia given, which is spinal. Then the position is the spine. That's abdomen, lower abdomen. The type of incision. I can't be able to see. I think it's loading slowly from my side. Let's go down so that we can be able to do very fast. Let's do the diagnosis here. It was obstructed. It's multiple gestation. Okay, let's do cesarean section if multiple gestation is not there. Mhm.
Confirm which one we should select.
What I can see here from here, it's null cell adenoma. So delivery, it should give us delivery thing about the put obstructed labor. We see if it can give us something so that we can be able to move. Okay. We can just bypass this and then we go to just save. Marianne, it seems like the diagnosis is misbehaving a bit.
Yeah,
So
let's try one more time to see if we can.
You try delivery. Marianne, we can do this. We can just save this and continue. Is it from my end? Because it's just
yeah, it's taking some time. I think there's a lot happening with the instance. Maybe people logged in as well.
okay.
We can just proceed. Let's see if we can be able to fill another form.
Maybe you can refresh so that you can fill very fast. Just maybe 2 things.
Let's give it a few minutes as we do that. We can maybe adjourn. You can organize. We take a few questions.
And then Mariana was requesting as we're sorting out the instance, we can have Jan and the SafariCom team do the biometrics training so that we can give the instance some time to set that.
Yeah, I agree. That is okay. Joseph, if you're ready, you can take up the session. Allow me to unshare on my end.
Okay, thank you very much. Nice presentation. As the system loads, let me share my screen and take you through biometrics. You let me know if it's up.
Okay, Joseph, as you're preparing to present, your screen is up. I encourage the participants who are here, as you're seeing, we're starting biometrics training, so encourage your colleagues to join.
All right, I see we have a good number. 224 is good, and then the call is also recorded, so you can share later on. So my first screen, I don't know, let me join also with my phone to just monitor as I move over so that I don't go to the next page and explain something you're not seeing. Just give me a second. Good. So as you can see, this is how to use biometrics on Kenya EMR portal. We have encountered biometrics as the new kid on block on different portals. There's provider portal, there's Tibabu, and right now we are on Kenya EMR. The flow is the same. The platform is the only different thing here, but the flow is the same. The requirements are the same. So biometrics is using a software called Health ID. So that means you need to have this Health ID installed on your device. There are people using tablets, there are people using desktops. So once you install this on your device, then now whenever you click biometrics to start a visit, this software will be detected and it will function with the scanners. So that's the first thing you need to know about biometrics. Why are we using biometrics? Of course, the first key aspect here is to ensure that patients are identified accurately, because fingerprints are you can't duplicate a fingerprint. You can't use another person's fingerprint. So when they're enjoying their SHA services, we want to be accurate that it is a specific person that is enjoying it. Also to accommodate patients who might not have phones, because not everybody is able to maybe afford a phone. Across the country, there are people who don't even have phones. They rely on relatives to issue OTPs. And this has a lot of time, it's really a time. So with biometrics, we are going to accommodate every person, because you're going to use their own fingerprints, and then reduce any lapses or time consumption to just improve the whole experience in terms of speed. Yeah, and it's a requirement by the government that all service providers are supposed to be using biometrics. So through sessions like this, we're able to understand how the workflows are happening. And today specifically, we're going to use it on Kenya EMR. So we have system requirements. Before we dive deeper, I can tell you about the normal. We have categorized them into two. The first one is hardware. As you can see, this is a normal computer setup, the desktop. At least because we have scanners that we're going to be using, make sure that your computers are USB enabled. For the desktop, it's a USB enabled because the scanners are going to be plugged in here. I know some are at the back of this CPU, you can use them. And always have space, or if your recycle bin is full and you're not using those files, you can delete them. So you have a space, because we are going to download the Health ID software, and we need space for so that the system is moving on faster. Yes, for your Windows, this Health ID software, it supports only Windows 10 and above. I know majority of us have Windows 11 and above, which is good. It's also come in with this aspect called 64-bit processor, which is highly recommended. So you can talk to your ITs to confirm if you're in Windows 10 and above, of which I know, because most of the computers are auto-updated whenever you're connected to the internet, but you can just confirm. So again, in terms of requirements, we have internet connectivity. We need internet. Some are logged in using facility Wi-Fi. Other people are using their phone to tether internet. But just make sure that if you're tethering through your phone, at least you have 300 MBs, because before we download this Health ID software, which is approximately 75 MBs, you need something more than that so that you can accommodate both download and installation. So those are the basic requirements you need for biometrics, that is in terms of hardware setups and internet connectivities. These are the scanners we're going to use. I know you're familiar with them. We'll advise more, but if you can see my screen on this page, on the left side, there's this black one called Superior Biomini, is very common. The right, I have the purple or blue one. As you can see, it is USB enabled, because the desktops, that's where you're going to plug them in. Yeah, so just advise these patients properly. They're supposed to place their fingerprints on this glass surface gently. If the scanners are supposed to be dried with clean with a dry cloth to avoid dust. And the patients, if their fingerprints are dirty, you can sanitize them and wipe them before you proceed, because we need a clear capture and verification. So if these devices are taken care of properly, you will have an easy time. Now, something to note, we are moving to the new phase where biometrics, we're going to use it on Kenya EMR. But remember, Health ID is still constant. It's being used on different platforms. So at the moment, I'm still confirming with the backend developers if it has been availed on the platform, so that you can just download this Health ID directly from Kenya EMR. But for this training purpose, let me show you how to download this from provider portal, because I'm not sure if it has been integrated already. But if you have provider portal, you can download it and make sure you have it on your device. So this is how to access it on provider portal. When you log in, there's this help button, right? We have stored it here. This will all be available on your Kenya EMR platform, so don't worry. At the moment, you can just click help. It is called Download Biometric Server Installer on all platforms. Yeah. So if you click that, it will start downloading. But now, depending on your computer setup, some computers are made in a point that before you download something, you must actually confirm. So if you click Download Biometric Server Installer from help button, you might see this pop-up appear on your screen. This is just the computer asking you if you're sure. Just click the 3 dots and select Show More, and then select Keep Anyway, so that it can start downloading. Remember, I told you, you must be connected to the internet. It will download, and then you'll go to the download section. It's called Health ID. Yeah. So once you download it, you must install it for you to use it. So how do you install it? When you go to the download section and look for Health ID, remember it is the software that supports biometrics. So you will double click it to open, and then it will tell you to get started. Yeah. So maybe somebody had tried doing this before, because if you click get started, it might tell you that the Health ID is already installed. But we don't want to assume. Maybe it was installed last year, and right now we are in a new version. Maybe it was version 1.5 that is there. So what you do, if you see this, just click and install to get rid of all those Health ID files that might be hiding in the system, because people are using these computers. Maybe somebody had tried doing it before. So that if you uninstall all those old files, you are now able to use whatever you have just downloaded right now. So once you do that, just click next and log in using your provider portal credentials. And if you click next, automatically it will start installing by itself. Installation is very easy. You just open it, log in using provider portal credentials, and then it will start installing. So as the installation process happens, you will see a pop-up appear. Don't worry, this is just one of the files that are installing, and the main purpose for this is to detect the scan, and that's why it's called the fingerprint driver setup. So if you see this, you just click install and then you complete. So right now, you know what biometrics is, you know how to download it from the provider portal. We're going to make things very easy for you. We'll bring it on the Kenya EMR platform so that you can access it from there. You don't need to go back to provider portal. This is just for the training purpose and how to access it. Meanwhile, as we wait for that new transition. So you also know the scanners that are available. And now let's see how you can use it on Kenya EMR. You log into the portal using your username and password. And on registration, you query the ID number of the patient. Yeah, you look up a member. So if you search, you'll see the patient. And then for consent purposes, so of course you have to you send them OTP. So once they give you OTP, now you're able to to identify them, and then you check them in. So if you check that patient in using this check-in button, you're now able to fill in the start visit process. Yeah. So if it is the visit type, or maybe it's outpatient, you enter that. The patient category, maybe it is triage. You are going to enter the is the patient exempted from payment? No, of course not, because they have an insurance. Select which insurance that is it. Information that you require to start a visit process. So if you go all the way to select adult consultations, you'll now get a chance to click start visit so that you can now proceed. So if you click start visit, this is what you're going to see. Two options as you were shown before. Use biometrics, use OTP. I know we have been shown how to use OTP because there are cases that maybe someone is an amputee patient, cancer patients, very ill, people whose fingerprints are faded. For those ones, you can use OTP. And for this case, let's proceed with biometrics. If you click biometrics, because you had downloaded the health ID file and it has been installed on your desktop, if you click biometrics, it will instantly detect that health ID. All right. And you will see this new face, the page here. This is now the computer communicating to you. The health ID has picked up and has given you an health ID interface. Yeah, the iframe. So for that particular patient, every person above 18, they usually go to Huduma Center to pick an ID, right? So that process of fingerprint capture, the government has that data, and that data has been integrated with this system. And that's why to tell you, that data, we are moving it step by step. So some patients have already 10 fingerprints templated in the system. Some of them have only 4 coming up. People have different cases. So the system is going to tell you for this particular patient, we only have these fingerprints in the system. So for the right one, tell them to place the right index finger or the thumb. Yeah. So you be very keen which finger is being indicated in blue on the system. If it is the left, tell the patient to place these ones. I know this. Some people have all 10, so just make sure that you read properly. And if you click start, the patient is ready, the fingerprint is dried clean, the scanner is connected to the device. Yeah, if you click start, it will lighten up, and then the patient will place that fingerprint there. And just like that, it will capture and verify in the data, and that's a success. So from there, you will receive these notifications that the visit has been started successfully, and the patient bill has been billed. Yeah, all those notifications will be seen there. And that's simply how to use biometrics option. We have the OTP option. Let me just do it one more time as you are told. If you select OTP option, yeah, of course you have to click. For someone who is already whitelisted, you have to click send code. They'll receive a code, and then they'll read for you that code. So if they read for you that code, you'll verify, and then you can start a visit. So a point to note on whitelisting, because I told you somebody has to be whitelisted. We have various edge cases. I want to do an email after this to Marianne and Grace with that procedure so that they can share with you, because we have cases whereby maybe someone is a child below the age of maybe 6. These people, they need OTP. The elderly patient, maybe someone's fingerprints and no longer visible. So there are very many cases, and when you're whitelisting, you will get a chance to identify why are you whitelisting. Just make sure that you briefly describe on that interface when you click whitelist, and then when you submit, the whitelist process approximately supposed to be within 24 hours. And if not, you can reach out to line 147. We help you to fast track using that ID number, because some cases are emergency cases and they need to be fast tracked. So basically, that is how to use biometrics. And if Timothy, if you're in the call, is there anything I've left behind you can explain, or everything is covered?
Thank you, John. I think we are okay. Maybe if you wanted to look into some whitelisting aspect of it, the reasons. If someone is unable to use OTP, you can You can just maybe quickly go through that. I think that's the only thing that I will left, and maybe if for the tablet, if you still have one for the tablet, we can just walk them through how to install Health ID on the tablet.
Okay, for the tablet, I'm still looking for the Kenya EMR procedure, not at the moment. Let me see if I have a wait list.
It's okay, but we will prepare that guide. But maybe I can just do a quick one.
White
Let me
list.
just yeah, it's okay. 1 minute.
Yes.
So I want to share my screen. Give me just a minute. I don't know if it was visible. So is it now visible?
Yes.
It's okay. So for those of you who have tablets, it's a very simple process. You need to have this tablet and this scanner. So as you can see, you need to connect the scanner to the tablet. The first thing that we need to do here is we need to ensure that the scanner is connected correctly. For now, you cannot be able to use the keyboard and the tablet at the same time and the scanner at the same time. So the request is, as you connect the scanner, you disconnect the tablet at the point which I am pointing, or you can put a piece of tape at the section so that it can now fit. I hope we are together up to there. Now for the second one, we have now the app itself. If you have the tablet that we have issued, the tablet in itself has the Health ID application. The only thing you need to do is just check on it if it's installed or not. Now, if your tablet, the one you have been issued to by MOH, does not have Health ID, you just need to go to Play Store, and then you need to search for the application and install it. So you just go to Play Store, type SHA. You can either type this name here, SHA, or type biometrics, and the application will appear automatically. Now, to the second part, now, because you have provider portal accounts that are still working, for the purpose of logging into this Health ID, you're going to use your provider portal accounts. Now, the provider portal accounts are not going to stop working even after you use Kenya EMR. They'll be used to log into the biometrics ecosystem, but not to send claims. So you will be able to just enter the email and the password and log in. Now, once you're logged in here, there's the next step where you will be able to see this window. In this window, it displays your name and the name of the facility, and it also displays the devices that are connected. So if you have a scanner, the scanners that Jan has shown us, they should appear in this section. You should just be able to see them, and then now you can do a test. Once you now do a test, this is the way the window looks. You can click on test device, and then once you click on test device, you'll be able to see your fingerprint. So this is the process in the tablet. Once now you've already installed it and you've tested the device, it is now ready. You can then go now back to the browser in Kenya EMR and use it there. So in using it in the browser, I just have a short video that I wanted us to watch. So 1 minute, let me just share my screen for that purpose, and then we can be able to now use it. So let me just play the video. Give me just 1 minute, as that I can open the window that has the video, then I can share.
And you share with the audio when you're sharing next time, so that we can listen.
It's okay. Let me. I don't think it has an audio. I did not include an audio for now. Maybe I just share it quickly. So I don't know if you can see my screen. Yeah, I hope it's visible.
Yes.
So in the tablet, the process is very simple.
Yeah.
We have just installed Health ID. So you just come to the browser and start using it. You do the patient search. Once you do the patient search, the patient appears. Once the patient appears, you send the first OTP. The first OTP is for identifying the patient. Once you send the first OTP, and it is added. So let's let's just follow the process. Once it is added, you will then click on verify. Then you'll click on check in. You'll check in the member. Then when this process you are all familiar with, you select the visit type. So this is a tablet. I've placed the tablet in a desktop mode. There are two things that you just need to do: install Health ID and go to the browser. There is nothing else that you are doing if you have a government issued tablet. So you select insurance, you select everything, you select SHA, you select a package. So for my case, I chose outpatient care. I want to claim consultation for a CCC visit. So I'll just select outpatient care, then an intervention consultation, and then now a chargeable service. I will select adult consultation. Then once I select adult consultation, I'll just go back and click on verify and start a visit. So when I click biometrics on the tablet, now this is the expectation. It will pop up a screen like this one. So for my case, because I don't have a scanner connected, it's saying no fingerprint scanner detected. But ideally, once you reach here, you should just continue with the screens that John was showing us for verification. So basically, that's how to use it on the tablet. So we shall share this video once it is we create the section properly. You shall circulate it to the groups so that anyone who would need to review it once more will review it. Then there is that other part which is on whitelisting. So let me just download it quickly, and then let me share it so that for those of you who want to do whitelisting, you can be able now to understand exactly what happens for these edge cases. So I'll share my screen once more. So these people who need whitelisting, why do they need whitelisting? As much as you're using biometrics will not work for everyone. We have people who have certain challenges that necessitate us to do the OTP whitelisting process. So part of this, we have people who, due to special circumstances, medical, physical, or sometimes when they're affected by technical barriers, where they are unable to do now the biometric authentication. So for these cases, we normally have to whitelist them. As you have been shown, there is that button for send OTP whitelisting. So when you do whitelisting, we have two ways. It can either be automatically approved or it can be manually approved. For automatic approval, you send a request. The system automatically checks criteria such as maybe age, oncology history, renal history, and it automatically verifies. Then there is the second one, which requires a manual approval. Now, if you require a manual approval, this is the case where maybe it's a critically ill patient, SHA needs to verify. It's an oncology case, SHA needs to verify. So those ones, they are now requiring now SHA approval. So for ones that require SHA approval, there are two items. Let me just go to the section. You need to select the correct reason. In the drop-down for whitelisting, you need to highlight why are you whitelisting. You need to say it's a critically ill patient, it's a technical system issue, and then you provide a detailed explanation, something that SHA can verify. Then lastly, you do attach supporting documents. Now, as we had said, for manual review, SHA normally takes 24 hours. So in such a case, if you're in the facility and you have requested for whitelisting and it takes a lot of time, you can reach out to your branch manager for assistance. Now, some of the reasons, we have critically ill or unconscious patients. For these ones, you just need to attach a small note from the doctor. For you, because we are trying to go paperless and you are in the HMIS, yes, yeah, there is no way to run away from that. You'll just have to use the paper. Just request it to be stamped by the facility. For people who have upper limb amputations, some of them have the disability certificates. If you attach those, SHA will just approve that person for a lifetime. So remember, when we are whitelisting someone for OTP, we can whitelist them for a month, a week, or forever. So if you want someone to have an easy time, you can whitelist them or forever. So these are some of the cases. We have people who have fingers challenges due to construction, due to oncology. We have dialysis patients. Then sometimes when there is technical issues and you are unable to use biometrics, you also do the same. So best practices, just review the reason before submitting, and then now you try to request them to follow up. You can request them to call 147 if you feel like the 24 hours will not be of service to them. You can request them to escalate so that they can be assisted quicker. I guess that's it from my side. We shall be doing this continue for the next for another one session, and then now that will be also for today. I guess that's all from my side. And you can pick.
Yeah, thank you for that, Joseph and Timothy. We are really grateful for that session. It's a session that we're going to have for the next couple of days so that people can really understand. So allow me to quickly get back to our patient. Unfortunately, we'll not be able to go through the entire maternity workflow because of time. So we'll just proceed directly to the to the bill items so that we can be able to look at now the processes that happen at the accounting section. So we will assume our patient has gone through the entire inpatient labor care. They have delivered the twins. They have been discharged. They are currently under discharging in their admissions. And either the person who is coming to help them with the discharge has been sent to go and settle the bill first before the discharge summary can be given out. So that is what we're going to do. So when they go to the accounting section, first thing I want to show the stepwise activities I was talking about. So one, the people at the accounts can be able to access the claim as it is building up. Remember, when we started with this patient at check-in, we already created a virtual claim form for them. So under accounting, from the claims tab, we will be able to see all patients who have claims within the system, who have generated claims and the particular stages they are in, showing the date a claim was created, the patient attached to that claim, the authorization code, the service type, the fund, either whether it is PHC, SHIF, the invoice number, and the stage a particular claim is at. So for example, for a patient, we have a claim that was created today at 9:47. To access that, you just click on the patient name, which is a hyperlink, to get to the patient particular claims page. From there, you'll be able to see over time, as this patient comes to the facility and they're using insurance to make payments, we can see whether they have any pending claims, any ones that have been successfully sent, any pending resubmissions, maybe they were sent and the payer recommended something be rectified, any that were closed over time, and any that have been finalized even payment has been done to the facility. So our patient, the one we created today, to access that, we can be able to see the date, the authorization code, the service type. It is currently under draft status, and we have not yet submitted to the payer. So we can also be able to view a claim at whatever stage we're in from the time that virtual claim is created in the system. So as we proceed to see our patient, we'll be able to access the claim summary. We'll be able to see interventions loading for our client, and we'll eventually be able to see the bill line items when we process the payment, the diagnosis, and even the doctor who is attached to this particular claim. So far we can be able to tell we have the cesarean intervention, which has a tariff locked or can be payable from SHA for 30,000. And there's an expectation that the user needs to do. There's some documents we need to attach, and we also need to load the bill lines, and we also need to attach the diagnosis and the doctor. So we're going to start with the workflow now for ensuring we submit a successful claim. starting with clearing the bill. As somebody confirms for me, our diagnosis has loaded from the clinical encounters and the clinical forms. So I'm going to go back to accounting. One, they can be able to access the patient bill by searching for a patient, so that you can be able to tell at a glance at the cashier desk, this person who is being discharged from inpatient, what are they coming to pay for? Have all the line items been added? So for today, we can see our client, this is the amount that it is pending. And for us to see that, we get to the payment page for our client, where we will be able to see details of our client, the invoice summary, and we can be able to process the line items. What has loaded is adult consultation when we started, an emergency CS from the procedure that we created that loaded that billable item with a price attached to them. And the amount that our client is supposed to pay, the total amount is 22,299, and we can proceed to process that particular payment. So the first step for this workflow is to ensure that we confirm all the billable items have been loaded. If there's something that has not been picked, the team know how to do this. For example, they can be able to add a billable item by searching for a patient. We just search for a patient quickly. Add a new bill item if something has been left out. We are adding billable items for this current visit when our patient is being discharged. Maybe there were some items they spent in the ward that were missed out. We can add some few things that have a price attached. Maybe a cotton wool was used. Maybe 4 of them were used. They are paying via insurance. Maybe there were some drugs that were given. I'm just going to add maybe something like paracetamol injection. They received this like 5 of them, just to build up the bill. And you can save and close. So when we go back to our patient here, in their accounting processing page, we'll be able to see that the bill has built up, and the current total amount now is 24,819 for all the services and commodities they were given during their stay at the ward. And the cashier can now proceed to process the bill by selecting the bill items. When we do that, we will find now the system will allow you to process the payment for the amount that is due. From the workflow that you have currently, we have this processing payment somewhere around here, but we have moved it in a way that it has been redefined. So by clicking on payments, the system will allow you or give you a payment workspace that shows you the amount that is due, the amount that is remaining. We can be able to select our payment mode. For our case, we're using insurance. The amount we expect the insurance to pay the total amount, which is 24,819. The intervention our patient is using or the insurance scheme is SHA, and we are selecting the intervention as SHA 8 for cesarean section. And we can even be able to see the tariff that is attached to that is 30,000. So that means whatever our patient has spent in our facility does not surpass this. If it surpasses, then we can advise them on other billing payment options. And then we can go ahead to save and close. So when we do that, the system will automatically generate a receipt that you can print for your patient, showing the billable line items and the total amount that has been paid, and we can print this for our patient. So when we go back, we'll find that now our balance is currently at 0 shillings, and we can go ahead now to process the particular claim. So that is the first step. Ensure one, you have added all the billable charges that our patient has used in this facility, so that again, we do not give services that we are not charging for. 2, once we ensure we have all the billable line items, now we can go ahead to process the bill. After we process the bill, the next thing we should do is to close the bill. So the system allows us to do that using the close feature here. Close the bill. When I select that, I need to give a reason as to why I'm closing the bill. So I'm going to say my patient has been discharged and close the bill. You will notice now the system will allow you to either do two things. You can still print an invoice, a receipt, a bill statement at this point. You can reopen a bill if there's something that you had not added. That is a new feature that has been included. And 3, now we can now be able to go ahead and submit the claim form for this particular patient by selecting here. So what this does, it just takes us to the accounting claim form page for this patient directly. So over time, we'll be able to tell for a particular patient some statistics on their claim activities. So if they have any pending claims so far, we'll be able to see how many we've been able to send successfully to the payer. Any the payer maybe has resubmitted back to us. Maybe they have an issue we need to deal with. Any bills that have been closed over time, and even the ones that have been successfully submitted, and even the facility has been paid for. So our concern is at the pending stage because we've not yet submitted our bill that has been created today, our virtual claim form, which is under draft status. We select that using the drop down for that particular claim. Then I will be able to see now from the previous where I had shown one, when we had not closed the bill, processed the payment and closed the bill, we could not be able to see the bill line items. So when we do that, we finish with the workflow for the cashiers and processing the payment. Now we'll be able to see bill items loaded. All the charge items have been attached to the interventions that we had chosen, which was 24,819, which this facility is now claiming to SHIF. And we can even see our diagnosis has now been attached. We can see our intervention. We can even be able to access the claim summary at this point, and the claim status is still under draft. So the next thing we should be able to do, one, we said for this claim to work, we need to attach a doctor who has a valid license. So that is the next step we should do. I hope you can see my screen. I've had to reduce my font kidogo so that I can access the doctor's section. So I'll add a doctor. Search within the facility for a doctor who has a valid license. So I'm going to use my user who had a valid license. When I do that, it will load for me their license number, their regulatory body, and I can go ahead to add a doctor, to attach a licensed doctor who saw this patient to this claim form for the submission to be successful. And the system will tell you a doctor has been added successfully. And now we can even be able to visualize who that particular doctor is. We have a test, Dr. John Waithaka Muthe, who has been added to this claim form. Now, the next step is to ensure that we fulfill all the mandatory requirements for this claim to be successful even before we submit. For the intervention we are having, that is cesarean section, the payer expects us now to be able to attach evidence or some documents for evidence supporting this particular diagnosis. So we'll be able to see there's some attachments that are required for this particular intervention, which was a C-section, and the tariff limit is up to 30,000. We are supposed to attach a birth notification, a discharge summary, the final bill, the claim form, the theater notes, and the discharge summary for this claim form. So we have two options here. The system, one, can generate these documents, those ones that are within the limit of the system. For example, what am I saying? We can be able to generate a discharge summary within the system. We can be able to generate theater notes. We can be able to generate the claim form, and we can be able to generate the final bill. But for birth notification, that's something that is not issued within the system, we will be able to upload directly. But for now, let's start with the workflow of generating documents that are already captured within the system. So here, you need to either just generate and upload, or if you cannot be able to generate, maybe the system has an issue that the upload factor is not yet working, we can still provide the option of uploading manually. So let's try to generate our discharge summary first. It will populate for us the discharge summary when the clinician filled it. And if you can be able to find it, all you need to do is to upload. If you can't be able to find it, maybe something has happened, you can either download it somewhere and upload manually. But before you upload this discharge summary, remember the discharge summary requires a doctor's signature. So you have to print, let the doctor who is seeing the patient sign, and then upload it somewhere manually for that to work. Or we can provide the process of having automatic signatures for our clinician, something our team is working on. So when I do that, the system is going to tell you that it has uploaded successfully, and it will highlight that in green and show you a successful uploaded message. Then quickly, we can still generate our final bill. Again, the system will give us that because we already have that upload. We expect for it to be successful. We also upload the claim form because we can access the virtual claim form. Now, if you can't, maybe because of something happened, let me just try to upload it manually. I don't know if I have a claim form, but I can just upload something in place of that. Let me use this. So one, it will give you a window to view what you're uploading, but ensure you upload the correct documents. And then we may not need any theater notes for now, but let me just upload that manually, just in case. Then when you're done generating documents, so the system can be able to automatically generate and upload. You just close that window. And now when you go back to our interventions where we had attachments, we'll be able to see we have several documents that have been generated within the system, the discharge summary, the final bill, and the theater notes. What we need now to upload is the birth notification that may not be generated by the system. And for that, I'm going to use the upload attachment feature, so that it allows me to select the document type, and now I can be able to add a file to it, select within the desktop or the device that I'm using, look for a birth notification for that particular child, and then upload the attachment. Again, you're going to get a successful message, and when you come back to your attachments, everything should be highlighted in green and ticked, meaning we have managed to upload the attachments that the payer requires for this particular claim to be successful. At the same time, the system allows you to be able to view what you have just uploaded. So when I click view, for example, for my birth notification, I'll just use one. I'll be able to see exactly what I'm uploading, so that I can validate it against the client. I don't upload a birth notification that is not meant for this particular patient that we are dealing with. Apologies for that. Just give me a minute. I go back to my system. Something happened. So going back to our patient, we'll be able to see that we have fulfilled what we need for this claim. We have our intervention in place, our attachments. We have even a billable line attached to a particular price. We have a doctor attached to this particular claim. Our diagnosis is in place. We can even be able to visualize our claim summary, and we no longer need to do anything about it. So we can go ahead and do what? And submit our claim. So by clicking the submit claim, the system will also allow you to see the amount that you're claiming for, discharge reason. These are the reasons that the SHA team have been using. So for this one, we can say whether recovered, referred, diseased, absconded, or other. We can say either our patient was discharged. It is going to attach a time for that claim and a date, and we can proceed to continue to submit this particular claim for 24,819 for our inpatient client seeking cesarean section intervention. When you do that now, this is what Timothy and Joseph were talking about. We have the last OTP, the last authentication by the system that is required. So when we have our scanners up and the biometric application running in our facilities, we can comfortably use the biometric option. But for now, allow me to use the OTP so that we can be able to proceed. When I select OTP, an OTP will be sent to the client to authorize for that particular claim to be sent to the payer. So let's just give it a few minutes. So get the message, still reading the same. Dear Marianne, please confirm information provided is accurate and consent to the cesarean section services for the visit, discharge, of yourself at this particular facility, kindly not making false statements under the Social Health Act of 2023 is an offense, and you proceed to get the OTP from the patient, 238462, and we verify. So when that is done, you'll find that now we have the claim has been submitted successfully. We can refresh our system and we can give it 2 to 3 minutes, come back and see now the different status that our claim is going to move to. So it's going to move from draft right now because we've submitted to another status, and now we'll be able even to see the pair interactions happening. Because of time, we'll hand over to Joan to take up the Q&A session quickly. Then we will come back after 2 or 3 minutes just to see the status change and the interactions and the feedback we will get from the pair for this particular claim that we have submitted. Joan, over to you.
Yes, thanks, Marianne and Jan and Timothy for
Is it my side or have I lost a John?
Chris, maybe you can proceed with the Q&A session as we wait.
Oh, okay. I thought it was my network which had gone out, but I'm saying I think we lost a John somewhere along the way. This has been a long session, but a very informative session. As you can note, we have now started introducing biometrics training. All these sessions that we've been doing, they have been recorded and they're up on YouTube. I have put the link in the chat. So particularly for today, where we've been shown how to install the biometric applications, please go rewatch those videos, try it for yourself. Maybe you can find the health work ID. But something I would like you to note is that we'll be upgrading level 2 sites and level 3 sites beginning today. So we'll have a very short learning curve. We'll have a very short learning curve for this work. If you require any help, any assistance, post in your groups. You are in all your groups, so we'll be able to support. Otherwise, I would like to thank the presenters. Thank you, Jan and Timo, for coming in such short notice. And Otione, unless there's anything else going on, I think we've kept the team here for over 3 hours. It might be time to release them so that even the presenters can prepare for the next session. But right now, let us see the status of the claim that we have been working with. Marianne, maybe, yeah.
Yeah, so maybe quickly, we can just go through the pair feedback. So for the claim that we are working on, we can see today the status has now changed from draft to submitted, and we are awaiting peer review. And when we get back into it, we'll be able to see still what we've done. So the interactions from the pair again, we'll be able to see some notification messages if you give it some time. So that they need to review the documents you have uploaded, attached, for them to give a feedback whether your claim has gone through. It will give a successful message and you can wait for payment. If it has been rejected, then you're going to get a rejection message, and they're going to give a reason as to why that particular claim has been rejected. This is something that the SHA teams already know what can make a a claim to be rejected. We've been going through this. One, if you don't attach the correct documents. Two, you choose the wrong intervention for the right package and so on. You do not have a diagnosis. You don't attach doctor who is valid. Some of the validations that we were talking about will make your claim not to be submitted. So over time, we'll be able to interact with the different status of our claims. We can also be able to review this, and even in our training instances, we encourage the teams to be able to just log in, just try it out and see how this is going to work for you and your facility as we prepare ourselves to procure the biometric devices that we need, the scanners, to support our teams technically with the installation of the application, ensuring all our clinical charges have a price attached, and now even support with the trainings to the records, the billing teams on these workflows. Thank you, and over to you, Grace.
Thank you. Thank you so much, Miriam. I hope you've seen both the errors, the successes. Good thing that this system has done is that every step of the way, if you do something wrong, the system will notify you. If you do something that is not supposed to be in the claim, if you do something which the claim will be a problem, the system is notifying you so that you can correct, so that you can also avoid these rejected claims. Unfortunately for PHC, the resubmission time for rejected claims is very narrow. And when it passes, you will no longer be able to claim. So I hope you've seen the workflows. We will continue these trainings up to Tuesday to enable you to orient yourself even as your sites have been upgraded, and we will continue working together. I have seen that for the counties, there is some worry around level 4s. We are yet to start level 4 training because level 4, there is the SHIF training, which is a bit heavier. When we start level 4 training, we will inform you guys so that you can also come on board. In the meantime, level 4s will not be switched off provider portal. We are starting with level 2s and level 3s. Once we upgrade the sites, the provider portal tentatively will be down from Monday night. So from Tuesday, you'll not be able to use provider portal. You'll only be able to use the TaifaCare system, the TaifaCare eClaims. So even during the weekend, make sure you orient yourself with the system. And if there are any issues, please raise them in your groups. We'll be able to handle. If I've been responding to questions on chat, so I don't think we need to do we'll need to do a Q&A. For Kiwandani dispensary, which county is this? Is this Kilifi? Kiwandani dispensary, which county are you in? Kilifi. Which sub-county? Right, the sub-county? Kilifi North, okay. Kilifi North, Kola. I will get the sub-county lead to reach out and help you put in the prices. For the rest of the teams, if you're having issues with inputting prices, one, the good thing is that it was demonstrated when we were starting the sessions. So again, use the resources. Go to YouTube where the videos are, the live streams are. Go through, make sure all your prices are right. Ukikosa kuadd price hautaweza kuclaim. Ukikosa kuadd madawa na umepatiana, umedispense madawa, hautaweza kuclaim. Utalipwa pesa kidogo sababu hautalipwa ya dawa. And now SHA is texting patients to verify that drugs have been issued. So there are a lot of checks and balances within these processes. Make sure that you do them correctly to avoid being blocked out of or being suspended from the claiming process. Otherwise, thank you very much for joining. Again, we've been on this call for now over 3.5 hours. Thank you so much for joining. Continue using the materials, continue training, continue orienting yourselves. And in case there's any issues in your forums, we'll support. Thank you very much. That's it from me, Miriam and Otieno. If there's anything else.
I think just a reminder that we are going to have the next session this afternoon from 2 to 4. So someone to tell someone.